Hello, I'm Dr. Jim Carlson from the Grove Animal Hospital and Holistic Center for case number 01705. This is an interesting case because we do have a healthy patient but has a history of vaccine reaction. And so we're trying to determine what caused the vaccine reaction, but also which vaccine was it, because the patient received two vaccines, feline distemper vaccine and rabies vaccine. And so if we look at this particular patient's IHC report, we can see that on the red side is stress. In stress and weakness, what it does is basically this has been going on for some period of time. And if we look at LY1 and LY2, this is tonsil and the teeth and jaw drainage. And SI3 is going to be the small intestine, but also its range is the low back, the lower small intestine. And on the stress side down here, this is more acute inflammation, and we can see there's two endocrine points, which are sensory points, and also the thyroid. And then we have another lymphatic here for the sinus tract. And so if we take a look at what's going on underneath, is that the lymphatic system is the reactive network. Basically, the fluid that circulates through the body is where all the wastewater, pathogens, and even sub-Q vaccinations go. And so if we do have weakness or stress there, vaccine can be a trigger point for this patient until those lymphatics are rebalanced. Also, the lower small intestine has its own nervous system and is 80% of the immune system as well. So you see we have lymphatic connection, we have small intestinal connection, and also sensory function. We get back to thyroid and pituitary and pineal gland. It also revs up the central nervous system and messes with the hormones. So that can also cause inflammation and reactivity as well. So which one was it? Rabies or distemper? So we look at this one right here. This is feline distemper. And the 4 points that were balanced from the previous analysis, we can take the feline distemper vaccine and see did it cause any stress in those 4 balance points. And the answer is yes, we have acute inflammation here. So feline distemper was one of the vaccines that caused the inflammation or reaction. Now what about rabies? Well, let's go to the next page. You see, rabies did not cause a problem because we have 4 balance points here. So the rabies vaccine was okay. It was a 3-year rabies vaccine, and that should be okay. It was the feline distemper vaccine. So that's
Did you actually put the vaccination on the test plate? How did that work?
We do. We take the original test analysis. We pick 4 of those that are balanced, and then we put the rabies vaccine on the test plate and test that, and then we take that off and put the feline distemper vaccine on there as well, and to see which one, if there's any reactivity, it'll typically show up. And this is a great predictor because we didn't vaccinate this cat. We went ahead and tested first to determine could we vaccinate, and if we can, which one would be safer. In this case, we see that rabies is not going to cause a reaction, but the distemper will. So we're probably just going to use the 3-year rabies on this cat. The kitty's also sensitive to things in the environment, not allergic, but it was sensitive to dairy products, sensitive to cooking products, which yeast is a big one, so we want to watch for yeast in the food. And also cooking oils, which occasionally we may add oil to the diet, especially coconut oil or canola oil. And so this kitty would rev up its immune system and cause potential inflammation there as well. So we'll be talking about what things to avoid, looking at the list and checking the food to make sure that the label doesn't show any of these products in there. So how are we going to rebalance? Well, we want to use a product called DrainPar because DrainPar is going to help to clear the lymphatics. It's going to decrease the weakness and stress in the central nervous system. And so we're going to focus and fuse on the 2 points that we see most commonly. So lymphatics and also endocrine. and then we're going to follow up with a little bit of SI3 there. So we're going to use drain PAR at 2 drops a day for 3 months. Retest, determine did we rebalance these points, and if we did, we should see a lot safer opportunity to vaccinate. So we won't vaccinate until we see that second test come through.